Welcome to Healing, Hope, and Health, the show proudly brought to you by Hospice of Washington County. As most of our viewers know, hospice provides quality end-of-life medical care as well as social and spiritual support to patients and their family members. But what about those patients with chronic disease who have years left to live? Have you ever wondered what support there are in place to help them manage their disease symptoms or the side effects from treatments? Fortunately, our next guest, Susan Lange, a nurse practitioner with LifeCare of Washington County, is here to shed light on those questions. LifeCare of Washington County is a palliative care practice, a medical specialty that focuses on managing symptoms and stress of serious illness with the goal of improving the quality of life for patients and their caregivers. Susan obtained her undergraduate degree in nursing from the University of Maryland in 1999 and her advanced nurse practitioner degree from the same school in 2004. Since obtaining her degrees, she has worked in a variety of medical settings, including hospitals, physicians' offices, clinics, and nursing homes. She's been a valuable member of the LifeCare team for a year. Welcome, Susan. Thanks for joining us.
Thank you for having me.
Sure. So, Susan, let's start off with, first of all, just talking about who would benefit from palliative care. What kind of patients, what are they experiencing?
Anyone who's suffering from a serious illness would benefit. Some examples would be COPD, emphysema, any type of cancer, Alzheimer's, Parkinson's disease, kidney disease, heart disease.
All those people would be appropriate for palliative care. Great, great. And what would patients who go to a palliative care practice, what kind of support would they receive? What would they expect?
The palliative care team is focused on quality of life.
Okay.
So we're looking at symptoms that are interfering with them living to their full potential. They could be nausea, fatigue, inability to sleep, a lack of appetite, pain, quite a few like that.
And so, and your goal would be to alleviate those symptoms so that they can move forward in their lives.
We're focused on relieving those symptoms and helping not only them but their caregivers learn how to manage those symptoms.
And I'm guessing if you have a patient who is all of a sudden has their symptoms alleviated, that would be a real support to the caregivers. It's a less stress for them because they're not seeing their loved one suffering.
Our goal is less stress.
Yeah. Good. Is palliative care available to patients still seeking curative treatments?
Many of our palliative care patients are still seeking treatment, and that is definitely one of our focuses. And we speak to the patient at every visit what their goals are, what their plans are for the next stage of treatment.
Okay. And where does LifeCare Washington County provide these services?
Palliative care organizations differ, but for LifeCare specifically, we have an office here in Hagerstown where we see patients. We have also seen patients in nursing homes, assisted livings, and we've also seen patients in their home. It really depends on their symptoms and sometimes the insurance also.
Okay, and that practice that you mentioned, that's in the Trilogy building, correct?
Yes, it is in the Trilogy building.
Okay, perfect. And does the palliative care take over the role of the primary care provider, or is that something that you work in conjunction with them?
That's a question we have a lot, and no, we don't take over for their primary care provider. We also don't take over for their specialist. We try to work in coordination with those who are already involved in the patient's care. There's a lot of steps and hurdles involved in care, and we're trying to make it a smoother process by coordinating things with everybody and making sure both the patient and their caregivers understand the steps needed and understand the treatments that are being offered and the treatments that they choose.
Yeah, I was just recently reading an article about palliative care, and they were saying that one of the primary roles is that coordination of care across a lot of different providers, and they described it as not a or, but an and. So it's an extra layer of support where you work in conjunction with and in addition to the primary care provider.
That's correct.
Right. Just quickly, how many nurse practitioners does LifeCare of Washington County have right now?
Currently, LifeCare of Washington County has 3 nurse practitioners.
Okay, so that's a lot of people that could benefit. Could you talk to us a little bit about the insurance with palliative care?
Palliative care is accepted with most insurances, including Medicare and Medicaid. If there's any questions about insurance, you can, the patient or the caregiver could reach out to Tara Bricker, who's the palliative care administrative coordinator for LifeCare of Washington County.
And she would be able to check their insurance?
She checks their insurance. She always makes phone calls. She touches base with primary care to make sure everything is secure before and ready to go before the appointment.
Okay, that's great. How about how can a patient receive palliative care? How do they initiate the process?
It's a very easy process. They can talk to their primary care provider, or they could speak with their specialist about the symptoms that they're having and their desire to try to find some more relief and a better quality of life. That provider will go ahead and write a consult order for us and faxes it to the office, and from there Tara takes over, contacts insurance company, the patient, lines up the appointment, does ask some questions to figure out if it's more of an office appointment or a home appointment, and then verifies insurance coverage, and then calls and schedules the appointment.
That's great. Well, thank you so much for being here and for shedding light on those important questions. I appreciate it.
Thank you for having me.
I'd like to thank Susan for joining us on today's program. The information she shared will benefit all of us, as we all have people we care about, friends, family members, or colleagues dealing with chronic illness. They may be going about their busy lives, but they may be doing it with unnecessary pain and stress. Don't you think they deserve the support of a palliative care team? Recent research shows that palliative care not only improves the quality of life, but can actually extend life. If you or someone you know would benefit from palliative care, give LifeCare of Washington County a call today at 301-671-2171. Stay close. I'll be right back after this short message.